Hi everyone, welcome back. In today's video, we're going to be talking about hypertension, also known as high blood pressure. It is one of the most common chronic diseases in the world and a major cause of heart attacks, strokes, kidney disease, and many other serious health problems. The surprising thing is that many people have hypertension without even knowing it, because it often doesn't cause symptoms in the early stages. That is why it is often called as the silent killer. In this video, we'll break down everything you need to know in a simple and easy to understand way. So let's get started. Before we begin, let's quickly look at what we'll cover. We'll start by understanding what blood pressure actually is, because that is the foundation of this topic. Then we'll define hypertension and discuss the different types. After that, we'll look at the risk factors, how hypertension develops, the symptoms patients may experience, and the complications it can cause if left untreated. Finally, we'll discuss how hypertension is diagnosed, managed, and most importantly, how it can be prevented. Before we talk about hypertension, we first need to understand blood pressure itself. Think of your heart as a pump and your arteries as pipes carrying blood to every part of your body. Every time the heart beats, it pushes blood into the arteries, creating pressure against the artery walls. That's what we call blood pressure. We measure it using two numbers. The first number is the systolic blood pressure, which is the pressure when the heart contracts and pumps blood out. The second number is the diastolic blood pressure, which is the pressure when the heart relaxes and fills with blood again. A normal blood pressure is often around 120 over 80 millimeters of mercury. Now that we know what blood pressure is, let's see what happens when it stays for a long time. So what exactly is hypertension? Hypertension means that a person's blood pressure remains consistently higher than normal over time. The key word here is persistent. One high blood pressure reading doesn't automatically mean someone has hypertension. For example, if you're nervous, stressed, in pain, or have just exercised, your blood pressure can temporarily increase. That's completely normal. To make a diagnosis, healthcare professionals use the correct measuring technique and repeat the blood pressure readings on different occasions to confirm that it's consistently elevated. To confirm a diagnosis, healthcare professionals use the correct measuring technique and repeat the blood pressure readings on different occasions to confirm that it's consistently elevated. Another important point is that most people with hypertension don't have any symptoms at all. That is why many cases are discovered during routine health checkups rather than because the patient feels unwell. Now that we have defined hypertension, let's look at the two main types of hypertension and why they differ. So there are two types of hypertension, primary hypertension and secondary hypertension. Primary hypertension, also known as essential hypertension, is by far the most common type, accounting for about 90 to 95% of all cases. It does not have one specific cause. Instead, it develops gradually due to a combination of genetic factors, aging, and lifestyle habits such as poor diet, obesity, and lack of exercise. Secondary hypertension is much less common, making up about 5 to 10% of cases. Unlike primary hypertension, it occurs because of an identifiable underlying condition. Common causes include chronic kidney disease, endocrine disorders, narrowing of the renal arteries, and certain medications. Identifying secondary hypertension is important because treating the underlying cause may improve or even resolve the high blood pressure. Now let's look at the factors that increase a person's risk of developing hypertension. The risk factors for hypertension are divided into two groups, non-modifiable and modifiable. The non-modifiable risk factors are those we cannot change. These include increasing age, a family history of hypertension, and genetic predisposition. Although we cannot control these factors, knowing about them helps to identify people who may need closer monitoring. Modifiable risk factors are those we can change through healthy lifestyle choices. These include obesity, eating too much salt, physical inactivity, smoking, excessive alcohol consumption, diabetes mellitus, and an unhealthy diet. By addressing these risk factors, we can lower blood pressure and reduce the risk of serious complications. But how do these risk factors actually lead to high blood pressure? Let's find out. The development of hypertension is usually the result of several body systems working together. One important mechanism is increased activity of the sympathetic nervous system, which causes the heart to beat faster and the blood vessels to narrow. Another key mechanism is activation of the renin-angiotensin-aldosterone system, or RAS. This system causes the body to retain sodium and water, increasing blood volume. At the same time, the blood vessels become narrower, increasing peripheral vascular resistance. Over time, these blood vessels undergo structural changes called vascular remodeling, making them stiffer and less flexible. Together, these changes result in a persistent increase in blood pressure. So, if someone has hypertension, what signs and symptoms might they have? One of the reasons hypertension is so dangerous is that most patients don't have any symptoms, especially in the early stages. That is why it is often called the silent killer. When symptoms do occur, they may include headaches, dizziness, blurred vision, palpitations, shortness of breath, or chest discomfort. However, these symptoms are not specific to hypertension and usually appear when the blood pressure is very high or when target organ damage has already begun. This is why regular blood pressure screening is so important, even for people who feel completely healthy. Now that we've discussed how hypertension presents, let's move on to the complications that can develop if it's left untreated. If hypertension is not treated, it can gradually damage blood vessels throughout the body, affecting many organs. Let's start with the heart. High blood pressure makes the heart work harder, which can lead to left ventricular hypertrophy, where the heart muscle becomes thickened. Over time, this may progress to heart failure, coronary artery disease, or even myocardial infarction, which is a heart attack. In the brain, hypertension is one of the leading causes of stroke and transient ischemic attacks, also known as TIAs. In the kidneys, it damages the small blood vessels, reducing kidney function and potentially leading to chronic kidney disease. The eyes can also be affected, causing hypertensive retinopathy, which may impair vision. Finally, hypertension can damage large blood vessels, increasing the risk of peripheral arterial disease and diseases of the aorta. This is why early diagnosis and treatment are so important. Since accurate diagnosis is essential, let's look at how blood pressure could be measured correctly. Measuring blood pressure may seem simple, but using the correct technique is very important because even small mistakes can produce inaccurate results. Before taking the measurement, the patient should rest quietly for at least 5 minutes. They should be seated comfortably with their back supported, both feet flat on the floor, and their legs uncrossed. The arm should be supported at the level of the heart, and the correct cuff size should be used. It is also important to avoid smoking, caffeine, or exercise immediately before the measurement, as these can temporarily increase blood pressure. Finally, we should take more than one reading and use the average for a more accurate assessment. Once we have measured the blood pressure correctly, the next step is confirming the diagnosis. Diagnosing hypertension involves more than just finding one high blood pressure reading. First, we confirm that the blood pressure remains elevated on repeated measurements. Next, we take a detailed medical history and perform a physical examination. We also assess the patient's overall cardiovascular risk, look for possible secondary causes of hypertension, and check for evidence of target organ damage involving the heart, brain, kidneys, and eyes. This comprehensive assessment helps us decide on the most appropriate management plan. To support the diagnosis and identify complications, we also perform several laboratory and imaging investigations. Once hypertension has been diagnosed, we carry out some initial investigations. These tests help to identify possible underlying causes, detect complications, and assess the patient's overall health. Urinalysis can detect kidney damage, while serum creatinine and electrolyte levels help evaluate kidney function. Blood glucose or HbA1c is used to screen for diabetes, and a lipid profile helps to assess cardiovascular risk. A full blood count provides baseline information, and an ECG is used to look for changes such as left ventricular hypertrophy or other heart abnormalities. Depending on the patient's history and examination findings, additional investigations may also be required. The first step in managing hypertension is lifestyle modification, and this is recommended for every patient whether they're taking medication or not. Small lifestyle changes can have a significant impact on blood pressure. Patients should reduce their salt intake because too much sodium causes the body to retain water, increasing blood pressure. Following a healthy eating plan such as a DASH diet, which is rich in fruits, vegetables, whole grains, and low-fat dairy products is also beneficial. Regular physical activity, maintaining a healthy body weight, stopping smoking, limiting alcohol consumption, and managing stress all contribute to better blood pressure control. In some patients with mild hypertension, lifestyle changes alone may be enough to bring blood pressure back to target levels. If lifestyle changes alone are not enough, medications are then added. When blood pressure remains high despite lifestyle modification, antihypertensive medications are prescribed. There are several classes of drugs and each works in a different way. ACE inhibitors reduce the production of angiotensin II, helping blood vessels relax. ARBs work by blocking the action of angiotensin II on its receptors. Calcium channel blockers relax the smooth muscles in blood vessel walls, causing the vessels to widen. Thiazide diuretics help the kidneys remove excess sodium and water, reducing blood volume and lowering blood pressure. Beta blockers are used in selected patients, particularly those with conditions such as coronary artery disease or certain heart rhythm disorders. The choice of medication depends on the patient's age, other medical conditions, blood pressure level, and current treatment guidelines. Although treatment is important, prevention is always better than cure. Preventing hypertension starts with adopting a healthy lifestyle early in life. Eating a balanced diet that is low in salt and rich in fruits and vegetables helps to maintain healthy blood pressure. Regular physical activity, maintaining a healthy body weight, avoiding smoking, limiting alcohol intake, and managing stress are all effective preventive measures. It's also important to have routine blood pressure checks, especially for people with risk factors such as older age or a family history of hypertension. Early detection allows treatment to begin before complications develop. Before we finish, let's summarize the most important points from today's lesson. Hypertension is a common chronic disease that often has no symptoms, which is why it is known as the silent killer. It can lead to serious complications affecting the heart, brain, kidneys, and eyes if left untreated. Accurate diagnosis requires repeated blood pressure measurements using the correct technique. Management begins with lifestyle modification, and medications are added when necessary. Most importantly, early detection and proper treatment can significantly reduce the risk of complications and improve long-term health outcomes. Thank you very much for watching. I hope this lesson has helped you understand hypertension more clearly. If you found this video helpful, please like and subscribe to our channel and share it with anyone who might benefit. I'll see you in the next lesson.